How confident are you guys with the abdomen?
We mostly just started today.
Okay. How about abdominal muscles? How do you guys feel about musculature? Okay, do you want to go through them? I'm going to try and make it interactive so it's not just like, because I mean, if it's not, you might as well just be watching a video. So, which one is this one?
External oblique. Yes, sir.
Okay. What about this one? Okay. Okay. Okay, we'll just act like it's there. It goes like this. Yes, okay. Do you guys remember which muscles, like what is the linea alba?
It's the line that goes
Avascular.
Okay, and why is that important?
you cut on it. That's the main
Right.
Surgery.
Right. And if you don't cut on the linea alba, then your incision's going to open back up. So it's a major holding layer of the abdomen. Okay. Let's see. Okay. Well, I guess I can go over this. That's okay. All right. So do you guys remember what muscles make up the superficial? Do you guys know what the superficial inguinal ring and canal and all that is? Yeah. Okay, so basically your external abdominal oblique and your internal abdominal oblique have a hole in it. I mean, it sounds really complicated, but it's not. It's a hole, okay? So the hole that's on the outside, this hole right here, this is your superficial inguinal ring, okay? Then you have your inguinal canal. It's like a, you know, like the toilet paper rolls? You have like 2 holes and a tube. That's all it is. Like, it sounds really fancy, it's not. So you have your superficial inguinal ring, and then you have your inguinal canal, which is what they travel through, like the tunnel, and then you have your deep inguinal ring, which is on the inside. Okay, that's it. That's all it is.
What about the vaginal ring?
Yeah, that's what I was gonna say. So, no, you're fine. So your deep inguinal ring has a vaginal ring around it. It's not anything that special. It's like, when you look at it, it just looks like a bunch of fat surrounding your deep inguinal ring.
So it's the same thing?
No, 2 different things, but it's like a fat ring around the deep inguinal.
The inguinal ring's inside of the vaginal ring, right?
Yeah. But like when you look at it,
I found it earlier.
is it good on this side? It's on the other side is good?
Yeah, over here, you can see it.
Yeah, so if you come look, this is your vaginal ring. You see all this fat right here? If you wanna look, the fatty part is your vaginal ring. And it's basically just surrounding your deep inguinal ring. So you have your deep inguinal ring, and then there's like a vaginal ring around it, and it's just fat. It's not really that important. Okay, what travels through the inguinal canal? I mean, yeah, for a male, yeah.
The vaginal tunic in the female?
Yeah, and then you have 2 vessels.
Is it
External pudendal.
Yes, and then in males, in your spermatic cord, you have your testicular artery and vein. You're gonna get more to all of that when you do repro, so it's not. Don't worry about it too much now. But so you have your spermatic cord, your pudendal artery and vein, and I think that's it. The most important things. Okay. Okay, so I have on here your peritoneum. It's kind of the same concept as your pleura, right? So your peritoneum is just like that peritoneum, the layer surrounding all of the organs and the outside. So you have your visceral peritoneum, which is covering all of your organs, and then you have your parietal peritoneum, which is on the outside, right? And then like when you're doing surgery, and you'll talk about it more when you get to neutering, when you go into your parietal peritoneum, that means you're in your abdominal cavity. That's what that means, basically. I don't think he's not gonna like ask you that question, but just to help you guys remember. So your parietal peritoneum is like this, and then your visceral peritoneum is covering all your organs. You can't really see it. It's like a single layer of epithelial cells, so you're not gonna see it with your eye that well. Okay. This is gross. So when you first opened your abdomen, you had all of this fat that's right here. Do you guys know what that is? It's like a bundle of fat that's right here.
Is it ligament?
It used to be a ligament. Yeah, your falciform, falciform ligament. But it was I think your hepatic ligament was the previous structure. And then below your umbilicus, it's the round ligament of the bladder. Okay, so just know above the umbilicus, it's your falciform ligament. Below it, it's your round ligament of your bladder. Just kidding, median ligament. Sorry,
The round
median
is with
ligament.
the liver, right?
You have a round ligament of your bladder, but you're just not going to see it here. Okay. Let's see. So, when you opened your abdomen, it was like this, right? What is this? Okay, yes. And then there's a smaller one that's right at the lesser curvature of the stomach. What is that called? Okay. So with your omentum, you have a superficial leaf, which is it's kind of hard to separate. But anyways, superficial leaf is like this. And then this is your deep leaf. And then in between these two, you have an omental bursa. Okay? So if I can find it, which I doubt, it might be right here. So now I'm in the omental bursa. I think it might have been ripped, so that might not be it. But the opening to get into your omental bursa, what is it called? Anybody? It's your epiploic foramen. Okay. Epiploic foramen. Yeah. That's important, and you'll be able to find it. When I'm done, I'm trying to just get through all the big structures, so when I'm done, if you remind me, I'll find it, because it takes me a minute. But that's important because your jejunum can herniate into your epiploic foramen. So then it gets caught, and then you can have all sorts of issues like obstruction and things, and you have to go in and take it out. So that's why that's important.
Where is it?
It is up here by your caudal vena cava, your portal vein, and your liver. So there's like, you remember those boundaries that we love so much, your dorsal boundary, your cranial boundary, there's some of those.
How do you tell, how do you know if it's the foramen or if it's like a hole that you made with your finger?
Honestly, if you can find it, you'll know. But the thing is, they're not gonna tag, he's not gonna tag the epiploic foramen.
Okay.
He's more so gonna, this is gonna be like a lecture question, and you're gonna have to know the boundaries of the epiploic foramen and why is it clinically significant.
Okay.
It's clinically significant because you can herniate your intestines into your epiploic foramen.
From the jejunum.
Mm-hmm. Well, yeah, your jejunum, we'll get there.
Okay.
Yes. I'm trying to go in order, because if I don't, we're never gonna get done. Okay. Here's your bladder. You kind of have to go, and some animals, this one's kind of like flaccid. In some animals, it's really hard. It's like a little ball. I think mine was really hard. Yeah, but it's back up in here, kind of in your pelvis, and y'all will get to the pelvic region more when you get to the reproductive organs and things. But this is your bladder here. This is a boy, so you don't have a uterus. But you all know where your uterus would be. Does anybody have a female dog? Okay. Okay. Make sure you look at the female dog, because I had a male, and so I mostly studied. I was A1 with the male, but when it came to the female, I was like, I don't know what I'm looking at. So make sure you find the people with the female dogs and look at them and get them to walk you through the structures and things.
The
Don't
part
forget.
that's normally right here is a female.
Yeah. Okay, so this is your spleen. Why is it so big? Does anybody
Because
know?
when you euthanize, the medication will cause it to become enlarged.
Yeah, so the barbiturates and the euthazol cause it to be this big. So it's not normally this giant, but your spleen lives on this side of your body, so the left side. Okay. And that's important to know because, it's not a clinic, but when you get to clinics, it's important to know for splenomegaly and for x-rays and things like that, you need to know that it's on this side of your body. So your gastrosplenic ligament is, I shouldn't have took my glove off, it's right here. It's basically, the good thing about the abdomen is that the names of the structures are where you need to go to find it. So the gastrosplenic ligament connects to your spleen and your stomach, gastric. So it's in between. Thanks. I'm trying not to get my iPad all disgusting. Or this is not an iPad, but you know, it's fine. Okay, so the next thing on my list is the diaphragm. So basically all you need to know is that this is this little center where you can see, I don't know if you guys can see over there, where you can see my fingers through. This is your tendinous center. That's what it's called, just your tendinous center. The muscular processes, this might be hard for y'all to see, but there's muscular processes that go from and they attach to your vertebrae. Those are your crus, your crura, plural. So you have a right and a left crura, or crus. That becomes important when y'all start looking at radiographs and stuff. So you have a left crus and a right crus, and it's just the muscular process that attaches back up here by the vertebrae. Okay. And then the other parts that it's talking about with the diaphragm is you have like a sternal part. Again, just it's what it's touching. So you have a sternal part, and then you have a costal part, and that's the most important thing about the diaphragm, other than breathing. And then the cupula. The cupula is just the domey part. So it's kind of hard to, it's more so, for me, it was more so of a concept to understand. So your cupula is like a dome like this, and it kind of goes into your thoracic cavity. That's the cupula. Not necessarily a thing, but a concept for me. Okay, so then you have 3 holes that go through your diaphragm. Does anybody know what they are? Mm-hmm.
Esophageal hiatus.
Mm-hmm.
And
what's the other big structure?
foramen.
Yeah, there's one other big structure that goes from your chest cavity into your abdomen. Big structure.
That's with a C, right?
Mm-hmm. Yeah. Yeah, it's the cable foramen. Yeah. So basically those are just, it's exactly what it says. You have your cable, excuse me, sorry, that was gross. Your cable foramen where your vena cava goes in, your esophageal one where your esophagus goes in, and your aortic for your aorta. Okay. Okay, so the next big thing, your next big thing is the liver. Okay, so you need to know your lobes of your liver, and it will come back to haunt you because I got asked in clinics this year, and I was like, ooh. Or not in clinics, this past summer. Okay, so you have a right medial lobe of your liver. You have a right lateral lobe of your liver. This one. Okay, so you have a right medial lobe, a right lateral lobe, a left medial lobe, a left lateral lobe. Okay. Then, oh, I'm so sorry, liver. Then you have your caudate process. Okay. Your caudate process has 2 processes, okay? So you have your caudate process of the caudate lobe, which is this one, and then you have your papillary process of your caudate lobe.
Where?
Caudate process of your caudate lobe, right here.
Okay.
Oh, I'm sorry, here. And then your papillary process. Okay.
So one's cranial, one's back.
Yeah, and then you need to know that your right kidney has it's called like a renal impression, I think, and that's on your caudate process of your caudate lobe. Yeah. Okay. So you need to know that because he
Is
would
it a
probably
renal
ask.
process?
Yeah, because your kidney on your right side sits higher up than the kidney on your left side. And you need to know those vertebrae, which I don't remember right now. I think it's like L2 to L3 and then L3 to L4. It's something like that, but you need to know those. But yes, your right kidney makes a renal impression on your liver. So know that, okay? And then your quadrate process is up in here by itself, okay? And then your gallbladder, just kidding, not this one, this one. And then your gallbladder sits right here. So that's your gallbladder. Okay. Since we're here, I think this is your hepatic ligament, this thick thing that I keep almost ripping. This thing right here, it's your hepatic ligament. I don't think it's that important, but since we're there, I'll show you. Your gallbladder, you have your gallbladder, and then you have a duct coming out of it. That's your cystic duct coming out of your gallbladder. I guess I could use this. So that's right here. Okay, and then later when we get to the pancreas, you have a pancreatic duct as well, and then your liver, you have a hepatic duct. So your cystic duct and your hepatic duct combine, and that makes your common bile duct. Okay, you'll have to draw it out because I had to draw it out like a million times. But so you have your cystic duct coming from your gallbladder, and then you have hepatic ducts coming from your liver, and those combine and make your common bile duct. Okay. Okay. Then your stomach. Did you open your stomach or no? Okay. So if you open your stomach when there's no food in it, it kind of, collapses. So those make rugae. Those are just the folds of your stomach. Rugae, R-U-G-A-E, I think. Those are just folds in your stomach, and then your stomach expands, right? So when your stomach is empty, it's considered intrathoracic, okay? Because if you notice, let's just pretend this was empty. It would be covered by your ribs. So your stomach, when it's empty, is considered intrathoracic. When it's full, it kind of pokes out down past these ribs right here. Okay? So when you can feel your stomach past your ribs, it either means that your dog is really full or you got something bad going on. Okay? Which is that whole GDV thing that y'all probably, I don't know if y'all talked about that yet. GDV.
Oh, yeah.
That thing is intense. Have y'all seen a GDV before?
Yes.
Oh my god. I saw one this summer and I was like, holy shit. Oh, sorry. I was like, oh my god. It was like, the stomach was like this big. It was a big German Shepherd. It was like 9 years old, and the stomach was like, I'm not kidding. It was insane. Crazy. Anyways, okay. So your esophagus comes into your stomach right here. This is your esophagus. Comes into your stomach right here.
Mm-hmm. Okay.
So the esophagus, once it's in the stomach, it kind of combines and makes this cardiac region of your stomach. Okay, and you'll learn in micro that different species have different sizes of the different regions of the stomach. Yeah, so I think pigs have a really huge cardiac region of their stomach, but dogs don't. Dogs and cats, I don't think they do. It's just kind of like right where it comes in at. It's like a little ring at the top. And I think he has a pretty good picture of it in his lecture of the different regions of the stomach. And then this little like balloony part right here is the fundus of the stomach. So this part right here, like it kind of balloons up at the top. This is the fundus of the stomach. And then you have your body. And then you have your pylorus. So your pylorus is this part. So you have a pyloric antrum, which I kind of thought is kind of like a funnel down. And then you have your pyloric sphincter right before you get to your duodenum. Okay, so those are the important parts of the stomach. And then you have the greater curvature and lesser curvature of the stomach. That makes sense. Okay. I guess we'll just keep going. So you leave your stomach. Also, just while we're here and I'm thinking about it, you need to be able to trace a bolus of food. Has he told you this? No. You need to be able to trace a bolus of food from the mouth all the way to the butt. Out into the world. Okay? So you need to know all, and when you do that, you need to know all the flexures of all the intestines, all the little curves, all that fun stuff. Okay? Okay, so you have your pylorus, and then you have your cranial duodenal flexure, okay? So right after your pylorus, we started our duodenum, you have your cranial duodenal flexure. It's just the bend. So flexure means bend, and then it's the most cranial one. So cranial.
Flexure means bend. Mm-hmm. Bend as in B-I-N.
Bend, B-E-N-D. Bend.
Oh, okay.
Yeah, okay. So cranial duodenal flexure. Then you have your descending duodenum. You need to know that your descending duodenum is on the right side of the body. He's gonna tell you that you need to know all, I'm sorry, I forgot that y'all doing this. He's gonna tell you that you need to know all of this because if you're doing surgery and things aren't in the right place, you need to be able to put them back where they go. Okay, so descending duodenum. Then you have your caudal duodenal flexure. It's just the more caudal one, flexure. Then you have your ascending duodenum here. So cranial duodenal flexure, descending duodenum, caudal duodenal flexure, ascending duodenum. Okay. Then you need to know. Do you guys know what this is? Before I tell you what it is.
No.
Okay. It's your duodenal colic. It's not a ligament. I forgot the name. It's on my list though. We'll get to it. But you need to know and find all of these parts because you don't want to get them confused with adhesion when you're doing surgery. So this is natural. This didn't happen after your dog died. This is a thing. So you need to know when you open up the abdomen, hey, there's this weird ligament thing that your tutor can't remember the name of right now, that connects your ascending duodenum to your colon, and that's important so that you don't rip it apart when you're in surgery because it's normal, okay? And it's just kind of one of those things that keeps things where they're supposed to be, okay? All right, so ascending duodenum. After your duodenum, what do we have? Jejunum. It's okay. I know a lot of people say things differently. Since we're here, I guess I'll just keep going. No, I'm gonna stop. So your jejunum is the most freely moving part of your intestines. So you need to know anytime he's talking about a herniation or something, probably like 100 times out of 10, it's gonna be your jejunum. Okay, if something else is herniating, then something crazy is happening and it was maybe like trauma or something insane. So this is your jejunum. What is all this clear stuff? Yeah. So this is your mesojejunum. Okay, mesentery's easy if you think about it, even though it took me a long time to understand it. So your mesentery is basically everything that's connecting all of your intestines, right? That's your mesentery. So you have a root of your mesentery, which is like, when you pull this up, there's just one part that it's coming from. That's the root of your mesentery, okay? And then everything else, again, it's named after what it's touching. So you have a mesojejunum, a mesocolon, a mesometrium, a mesovarium, mesosalpinx, like it's everything that it's touching is meso da 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 da. Okay, so this is your mesojejunum. And then what are these? Yeah, mesenteric lymph nodes, and you usually have like buccoodles of big mesenteric lymph nodes. Like that's one. There's a bunch of them, and they're big. Okay, and that's important because of the fat absorption and things through the lymph and all that. Y'all have GI phys, right? That's my face when it comes to it too. Okay, so let's trace. So we have our jejunum. And if you ever get turned around, which I do a lot, trace your intestines to figure out where you are. Like, it's only gonna go one way, you know what I mean? And that's gonna be important when you get to the horse because their intestines will take up this entire table. It's insane. Okay, so you have your jejunum, and then what's next? You done?
So whenever you're done, we'll switch.
Okay.
No rush.
Okay, yeah, so your ileum. How do you know that it's the ileum?
It's hard.
Yeah, so it's a little thicker. And then also, the lady, I don't know if you watch her videos, Minnesota lady, watch her videos, she's a rock star. But she's gonna tell you about this vessel. I don't think that DeFollow will tell you about this vessel, but it's the anti-mesenteric artery, and that's how you can tell that you're on your ileum.
Where?
Anti-mesenteric artery. And I don't remember if he tagged it because I honestly don't remember if he told us this or if we just found this trick and took it and ran with it. So that's your anti-mesenteric artery, so this is your ileum. So if you can't, some dogs it's hard to kind of demarcate where it's at, you can tell based off of that. What is this weird nasty thing right here? Yeah, your cecum. Does it have a function really in dogs or cats?
It's mainly like horses.
Yeah, horses and ruminant. Well, yeah. Yes. Okay. So eventually, you guys will cut open this area right here, and there's going to be two openings that you need to know. Okay. So one is going to be your cecocolic orifice, and it won't be hard to tell because if you stick your probe in, it's going to either go to your cecum in your colon or your ileum in your colon. So you just do that to figure out what it is, right? So you have your cecocolic orifice and your ileocolic orifice, okay? just 2 holes. That's how the food passes through, whatever. Those are important for, does anybody know what they're important for? Intussusception.
Say that again?
Intussusception. So, yeah, so you're gonna have, so your colon is really big, right? Your colon's like this, and your ileum is like this. So when you have intussusception, it's gonna be a tunneling of the smaller intestine into the larger intestine, okay? And I think a lot of things can cause it. It's really, like, when I've seen it, it's because of like maldigestion and bad food or something like that.
It's not supposed to happen.
It's not supposed to happen. No,
okay.
It's like super painful. It has to be fixed surgically, and you basically just go in, take it out, and you just like pull them apart real easy, and then you're fine. Sometimes, I think he says in his PowerPoint, sometimes it'll cut off the blood supply, and then you got to do an anastomosis and all that fun stuff. So, but intussusception will happen here. Okay. So you have your cecum, then you have your colon. Okay. So you have your ascending colon, which is like super short. It's just a nugget of colon. Okay, and then you have your transverse colon here, and then you have your descending colon. Okay, and then after your colon, I'm gonna just tell you now, if this man tags right here and asks you, is it colon or rectum, please put colon, because we put rectum and he about cried. Okay, and then your rectum is like way back here, and then to your anus. Okay, I can't show you because it's in your pelvis, and you'll have to like crack these open to get to your pelvis. But yeah, so descending colon, and then rectum, anus. Okay, so that's how you need to be able to pass that bolus of food all the way through. I feel like I'm taking a long time. I'm sorry. This,
a lot more over here than
there's a lot. I was looking at it today. I was like, oh. Okay. This weird thing is your pancreas. This little tiny thing that makes all the problems happen and things. Yeah, it's your pancreas. So you have your right lobe of your pancreas, which is along your descending duodenum, and then your left lobe. Your left lobe of your pancreas is here, and it kind of falls like right at your stomach, right here. And your book and your PowerPoints will tell you a lot more scientific things on how to find all these things, so make sure you go back and look at it. But this is your left lobe of your pancreas.
Here?
This one.
Okay.
And this is your right lobe of your pancreas. And then you're gonna need to cut. You're gonna need to cut open your duodenum right here, and you're gonna find your major duodenal papilla and your minor duodenal papilla. Does anybody know the difference between dogs and cats with those papillae?
One's bigger.
Major.
Okay.
Good try.
It was the minor one is more important for dogs, and the major one's more important for cats.
Yeah, so cats don't have an accessory pancreatic duct, and your accessory pancreatic duct is what opens at your minor duodenal papillae, so they don't have one. So that's a species difference that he may ask you.
And that's where the gallbladder and the pancreas secrete from.
The major one. So the major one will be the pancreatic duct, and your common bile duct
Okay.
will come into your major one. And then your minor one will be your accessory pancreatic duct, which your cats don't have. So I think some cats you might find one, but it's kind of pointless, so it went away. Your kidneys, what's important about your kidneys anatomically? Like location-wise? Well, yeah, that's important. No, but that was a good one. So your kidneys are retroperitoneal.
Right. They're
Yeah.
on the outside of
Yeah,
the
so
cavity.
this is a good time for you guys to see the peritoneum, this covering. So your peritoneum goes whoop and goes right over your kidneys. So these lie retroperitoneally. And I don't know if he talks about surgery, but it's like surgical access. You'll go in a different
This
part
is the
place.
peritoneum?
This is your peritoneum, just covering the kidney. So your kidneys lie outside of your peritoneum.
But it looks like it's in it.
No.
I mean, I guess depending on how you look at it. So this like layer right here that's covering this is your peritoneum, and then your kidneys outside of your peritoneal cavity. So it's outside of the peritoneum. So like you have back, stuff, kidney, peritoneum.
Oh.
Yeah.
Is there like an anatomical reason why, like a reason why it's not inside of the like abdominal cavity? Like an advantage to it?
I think DeFalo would say that's the way God made it.
Okay.
So I'm gonna stick with that. I don't know. But yeah, so remember that they're retroperitoneal because that will never leave you. Oh, that's okay. You need to do that anyway. So eventually, when you get to it, you're gonna take your kidneys out of this. You're gonna break them free, and you're gonna cut into them, and you're gonna be able to. You need to be able to identify the renal pelvis, your renal pyramids, and there's another thing in here. I'm not gonna be able to see them because all of this. I mean, I can like rip into it, but it's gonna be probably hard. So your adrenal glands lie. Okay, so this is your probably renal artery. So you have a renal artery, a renal vein, and then your ureter. So this is your aorta. I can't tell. And they all enter the kidney at the hilus. That's just the name of the part of the kidney that they come into.
That's
is
the
hilus
hilus
of the
right
kidney.
there?
So this is the hilus of the
Which
kidney.
one's the ureter? Oh, you can't see.
I can't see. You'd have to like dissect it. I think this might be the ureter, this little tubey thing, or it's this actually. That's a lie. It's this. This is your ureter.
Okay, that's what
So you know your ureters go to your bladder, and then you have your urethra, and then you pee. Yeah, more or less. So I think that this is your renal artery, and then this might be your renal vein. But it's not so hard to find when you're tracing your aorta. So yeah. Did I miss anything big organ-wise? Anything? I don't think I did. That's probably all I can show you today until you guys get into your kidneys, and then I can come. We're gonna try and come every